Hello, welcome everyone. Thank you for joining us today for National American University's webinar series focusing on careers in healthcare. And today we're looking at the healthcare field from an employer's perspective. My name is Nancy Reggio, and I'm Director of Marketing here at NAU. And I'm so pleased to have you here with us. We do expect a number of participants, so we're going to wait about 2 or 3 minutes before we start the presentation, and I'll be back on the line then. Thank you so much. Well, hello and welcome to the third in NAU's Allied Health webinar series. Today we're joining Dr. Smith, Associate Dean of the Online Allied Health Programs at NAU, and Ms. Sarah Covington, Vice President, Revenue Cycle at AIE Medical Management. And remember, at NAU we do have lots of degree programs, so please take a look at www.national.edu for more information. And before we get started, I just want to share a few reminders with you. First, your lines are on mute, and we do that to reduce the background noise, but we do want your participation, so please use the question and answer section. Send us those questions, and at the end of the webinar, we will spend some time answering those questions live. And second, we are recording all of this, so you will receive a full copy of the audio and video from the presentation. And with that, I turn it over to Dr. Smith and Ms. Covington.
Hello everyone, and welcome, welcome. We are so excited to have you here today to learn more about healthcare management. So today we're going to go over healthcare management from an employer perspective. And I am joined by Ms. Sarah Covington, who has an outstanding resume and has been in healthcare management for a number of years, and she'll be able to share some insights as well.
And thank you for having me join in. It's great to be here.
Thank you so much. So why are we here today? We're looking at these opportunities in healthcare management so that we can help you to understand more about what this field entails and how to actually get a job in this field. So starting out with getting a job in healthcare management. Thanks to a growing population, particularly for our baby boomers, healthcare management is a growing field today, and the more the field becomes involved in everything that operations does in a healthcare organization, the more people will require to make sense of all of this information. So you may ask yourself, how do I go about ensuring the best advancement in my healthcare management career, or what matches what I desire to do? Getting a job in healthcare management, you would need proper academic training and previous work experience, but don't let that deter you if you don't have that previous work experience. In order to be considered for a job in healthcare management, it's necessary to obtain that degree and get that proper education and training. It's also preferable that candidates display a strong commitment to continuing their professional development throughout their career, because we're known as lifelong learners, because healthcare changes every 6, 12, 18 months. So we're continuously learning. Also, having excellent communication skills is one of those really amazing skills that employers look for, because they want to know if the information that you're sharing is able to be communicated effectively and efficiently. You must be able to communicate with your colleagues, your subordinates, your superiors. Communication skills will be absolutely paramount and imperative when you're required to develop and also present reports and proposals. Having flexibility, adaptability, and an overall good organizational fit is also what a healthcare management employer would look for. One of the things is that candidates who fit well in a particular organization tend to thrive better. And once you find that, once those employers look at you and you find that you're a good fit, and the employer finds that you're a good fit for the organization, they really work with you to help enhance and build that culture. Additionally, displaying an attitude and appearance of confidence and competence will help you as well to become more flexible and adaptable and land you a job as a healthcare manager. Also, having dependability, good professional judgment, strong character. In order to be an effective healthcare manager, you must have a good, what we call moral compass, that will allow you to make honest and ethical decisions, especially when you're talking about people's lives. Employers are also looking for individuals with those strong character traits who will commit to their healthcare organization. And as a manager, you want to stay committed. You take a leadership role and others will follow. I'll go ahead and turn it over to Sarah to talk more about those cross-cultural communications and diversity, and also volunteering in terms of what healthcare employers look for in a job applicant.
Absolutely. So one of the great things about getting to work in healthcare is that it is a very diverse environment. And with that, both within patients and within those that you're interacting with in the workforce, it's important to also have strong cross-cultural communication skills, being able to be sensitive to what those individuals have as terms of values and differences amongst each other. And the second bullet point that we wanted to add in was always being the first to volunteer for the task that nobody else wants. As a leader, I find that to be a very important quality. The person that's always willing to do what needs to be done, even if it's not the favorite project to be assigned. That tells me that they really understand what our organization is trying to achieve, and they have a clear direction that they want to their career to be going in.
Absolutely, absolutely. Let's jump on into when you're engaging in that volunteer work, donate some of your time when possible, because what that does is help to fill in the gap for any previous work experience that you didn't have. So volunteering at a healthcare organization, whether it be filing records or, just getting your foot in the door to understand more about the organization you seek to work for, is very good, and also looks good on your resume to show that you actually donate your time to others and you actually want to help out. Because we look at applications for existing skills, we look at it for, that dependability and those things that we talked about and the reliability, but we also want to understand more about the candidate as well. So don't be afraid to add that unrelated work experience, because healthcare management involves a lot of what we call standard business management practices. And you ultimately wish to advance in your career, so a little diversity in your portfolio does not hurt. Consider going back to school. We always talk about being lifelong learners, and sometimes that may take the place of formal training or informal training. But when you're considering going back to school, especially if you're looking for a degree in healthcare management, there are so many different possibilities, and having that degree in healthcare management or other professional certification helps to narrow that field down for you to be able to find your niche, find exactly what you want to do. Practice your leadership skills. Leadership and administrative skills are so very important in healthcare management today. One of the reasons is because of the booming industry, and there's uncharted territory or ventures that healthcare hasn't been in before. So as you learn more about these things, you have to actually be able to manage these things, and you actually have to be able to lead people. And you typically want to practice those leadership skills by putting yourself to the test, even outside of the professional setting. Learn, like executives and upper level administrators, look for people with obvious leadership qualities when choosing applicants for especially highly responsible positions, which healthcare management is what I consider to be a highly responsible position. And lastly here, as you're making yourself stand out as a job candidate, invest your time wisely. I watch a lot of videos, read a lot of articles. I try to stay up to date on the healthcare industry so that I'm understanding what changes are going to occur that's going to directly affect, those in an organization. And you have to understand, when I say invest your time wisely, look at those things that will put you or help you to stand out. Look at those things that will help you to enhance or refine your skills. Ms. Covington can also share what she has in terms of what will help you stand out as a job candidate.
Yeah, so along with these bullet points, sometimes one of the questions I get is, well, how do I practice leadership skills? Like, how do I get started with that? And actually, that ties right in with volunteering, because while it can be difficult to start garnering those skills in the workforce outside of a leadership position, You may have an interest that you engaged in during your elementary, high school types of years, even into college, that would allow you to take on a coaching position. And a coaching position is a great way to both volunteer and demonstrate community commitment, also start engaging and developing those leadership skills. So it can be a very symbiotic approach to that development. Personally, I routinely volunteer. We also, as part of our company, have the expectation that all of our senior leaders volunteer and are engaged in the community. It's not a formal written policy, it's just part of our culture because we are the communities that we serve. And I also am continuing in my education. I finished certification through Harvard Business School online this past summer, and I'm actually starting into certification for business law through Cornell University next week on Christmas Day, right? Of all days. So I also really feel like it's important as a leader that we are demonstrating the expectations that we have of our candidates.
Absolutely. And as you mentioned, being able to demonstrate what that means, you have to understand how that transitions to the value that you have in an actual healthcare organization. Some of the responsibilities of a healthcare management professional include making sure that the operations are there, making sure that, that there are efficiencies in place, cost reductions, cost savings, to be able to make it better for our patients. Some of the requirements are a strong balance of healthcare knowledge and business acumen in order to keep facilities, number one, safe, number two, efficient, and number three, profitable in order to continuously work for the community that you serve. And now I'll turn it over to Ms. Covington to share some of the values of her particular role in healthcare management.
My role tends to vary quite a bit because I have a non-traditional work environment now. So I do work remotely predominantly, and then I also engage in on-site client visits. I am routinely dialoguing with C-suite from coast to coast. I have staff right now located in 4 countries, one of which is the United States. And next week I'm flying down to go and visit my staff in Florida. I also have staff in the Philippines, in Egypt, and in India. So some world traveling involved. You never know what country you're going to find me in. 2 months ago, I was down visiting a team in South America, Cali, Colombia, because we are launching another site that's going to be a little bit closer based here to the United States. So from day to day, my job never really looks the same. There's never a boring day, which I greatly enjoy, but it's also never finished. So if you're the type of person that loves for things just to be done, I would say there's probably some other paths that you might want to consider that would be a little bit different than what I've chosen for myself. I think that it's really exciting to be in healthcare because it is always changing, and we have this really complex delivery model system, and our jobs is to simplify it and make it as seamless and easy for both the patients and the providers of that clinical care. So it always is presenting kind of these unique situations because none of our patients are the same. They're not just a number that comes across on the screen, right? Every one of those numbers is representative of a real person, and how we handle that does have some variation based upon those unique needs. I formerly, though, was in more traditional roles and working for the healthcare systems. I worked for 3 healthcare systems, and for each of them, I had an office. For the last 2, I actually had 2 offices because I had staff in multiple places. And so having an office in each location just allowed for a lot more accessibility. And with those routinely engaged in meetings, there's some days, even now I'm booked from 7 a.m. until 6 p.m. for meetings with a non-traditional work role, right? Sometimes I even have meetings at 11 p.m. or 2 a.m., just depending on the day. More traditionally, though, just throughout the day. Also, cross-collaboration with other departments is really important in the more traditional environments because you're all working together to get the patient seamlessly through the continuum of care.
Absolutely. And I do appreciate you going through the traditional versus non-traditional. And as we look at, what healthcare managers and administrators do traditionally, typically work in an office, as Ms. Covington mentioned, a group practice, behavioral health nursing home, in an office, among other healthcare organizations. And you're able to speak to people in a variety of environments. It may be several meetings that you have to attend, but not only that, following up and following through from those meetings. Lead community meetings, meetings with other organizations. We've done it all, because what real life looks like for one person in healthcare management, these are some typical things. It may not look exactly the same for another person. And as Ms. Covington mentioned, it's never boring. I sometimes say, you know, we can have our own reality show, but everything's protected, so you couldn't show anything. And, you know, the job, and I'll read this here, a job of the healthcare administrator known as a healthcare executive or manager is similar responsibilities of those in leadership positions. So as Ms. Covington mentioned, you know, practicing those leadership skills will help you get to where you need to be. And so it's just an awesome field to be in. And your work setting may not be identical to someone else's work setting. And in saying that, we have differences even in the facility size that we manage. The culture, expectations, scope of responsibilities, and level of expertise may all vary. And I'll let Ms. Covington share a little bit of her insight about the small versus large facility and how that looks in healthcare.
Right. So small facilities and practices that I tend to engage with, the leaders in those practices have a wide range of responsibilities. They wear a ton of hats and have knowledge in numerous different areas. What I find with larger facilities, and also having worked for large health systems, is that the roles are much more narrow because there are different areas that have those responsibilities and entire teams that take care of these things. And so the level of expertise that's required when you become a leader of one of those areas tends to be much greater, right? Those are the individuals that we tend to see speaking at conferences and sharing that knowledge base. So both have benefits, right? In the small facilities, you're kind of a jack of all trades. You get to learn some of everything. And in the larger settings, you really get to become specialized and an expert in what you do.
Absolutely. And having that experience in a small versus a large facility myself, you nail on the head, because it really makes a difference. If you're in a smaller facility, you typically do more because you're learning more, but you're more responsible for different areas because it's a smaller facility. And I don't know, I can't say that I like small versus large. It's just point in time and what I'm learning, you know, so it's very, very intriguing.
And I think that's a great point. You learn different things from having experiences in both, which the more well-rounded you are, the better you're going to be able to serve your organization.
Absolutely. It helped me to carve out my niches because I was able to learn so much. I found something that I really, really, really enjoyed, which was more so for me, the education and training aspect.
Yeah.
But go figure. But it has been a tremendous roller coaster ride. And I say roller coaster, the fun roller coaster, not the one you're scared to death on, because there are so many different twists and turns in healthcare in the facilities in which I've worked. You know, it has been a phenomenal experience thus far. Some of the typical responsibilities, including coordination of medical and health services, management of facilities and finances, staff, and ensuring compliance. Under coordinating the medical and health services, that's one of the primary concerns of the healthcare managers, because you want to ensure, number one, that the patients and clients receive the correct services in a timely and optimal fashion. And the position includes directing various activities involved. It could be from nursing to therapy, radiology, surgery, recovery, depending on the type of healthcare organization you're working in. Also, healthcare managers need to have an understanding of medical records, which is my first love with medical records, because I was so intrigued in all of the information that it entailed, because I didn't want to do direct hands-on patient care, but I love the medical field. You want to make sure that you understand those medical records, and also that the patient's records are properly maintained. Also, this role is for expanding or contracting existing services, so you need to know about budgeting, requests for proposals, and things like that. Also, when you're managing these facilities and finances, it ranges from overseeing those smaller to larger. I mean, you have $1 million budget versus multi-million dollars or even $1 billion budget, depending on where you are. This includes under the management of facilities, maintenance, cleaning, contractual, improvement in order to benefit efficiency and functionality for your healthcare organization. It's also very important to have an in-depth knowledge of activities in the organization so that you're more forward-thinking and you're looking at things from a different perspective to make sure that your time and resources are distributed accordingly. When you're managing staff, healthcare administrators often take care of hiring. So you have to learn more about human resources and what all that entails in healthcare management to be able to fill those open positions. Staff schedules must be maintained and created. This is also another responsibility of someone in healthcare management. As conflicts arise, you have to be able to and be called upon to moderate different activities and scheduling staff. So understanding the management of others is also key and a responsibility of a healthcare manager. And lastly here, ensuring compliance. You know, we're heavily regulated in the healthcare industry, so it's the job of the healthcare manager to assist or manage with the process in ensuring that those regulations, whether they be federal, international, federal, state, local, you know, you have to understand, number one, what they are, the changes that are taking place, how they're going to impact your organization, and how to best communicate that to those who need to know and help to implement changes based on those laws. I'm sure you have some other responsibilities that you would like to share, Ms. Covington. I'll turn it over to you.
So in terms of management of staff, you know, I love that you mentioned about the hiring process. I'm actually going through the hiring process right now for a director role that is within my purview. And it's so interesting to me to get to just meet candidates and people from all over the country that are interested in coming to work for the organization. And even in my previous roles, when they were much more locally based, you still get to meet a ton of different people with being in management. And what I would always encourage you is to consider as you're going through an interview process that you have an opportunity to meet that person, not just for that job, but for the organization. Because what it may come down to is you might not be the right fit for that specific role, but that manager likely knows other managers within the company that has openings. Or that manager might know that they have a job coming open in about 2 months' time that as they're interviewing, they're considering you for. So I would always encourage a job seeker, never be discouraged to go and attend multiple rounds of interviews or with multiple panels. Sometimes we get nervous when there's more than one person in the room because sometimes there's underlying sources or causes that are precipitating those decisions.
Absolutely. And I know when you mentioned doing and putting your best foot forward to be able to handle some of these responsibilities in interviewing, I received my first, full-time 40-hour-a-week career job with benefits 2 months after I finished an intern because a position was becoming available. And when I interviewed, they were like, oh, we don't have this, but this is becoming available and we want you in this role. So I am right there with you, Ms. Covington, in terms of being able to share this knowledge with those that are participating because it really, really, really does make a difference. Let's see, a look ahead. So, wait, it feels like I missed one. There we go. Okay, so a look ahead. As we're looking at an aging population of baby boomers, increased size of hospitals and healthcare systems, cost cutting in healthcare for the future, and also community-based healthcare centers, these are some of the biggest trends in healthcare. And in having these big trends in healthcare, you also have to understand that technology is key. And as we go through the several technological advances that we have, it is, first and foremost, intriguing of what we can do in healthcare with technology. And because it's becoming so much more prevalent, it's helping to extend the life expectancy. It's helping people to live a better quality of life. This is why the iron is hot right now in healthcare management. Looking at telemedicine and as we're doing now, typically you need to come to one of these workshops, back in the day, you had to come somewhere, drive there, park, go into the conference room, make sure that the the temperature is right, make sure that the speaker can hear you. But now we're doing these things virtually. So think about it in terms of telehealth and telemedicine. I can be the doctor that's speaking to you and helping to assess and diagnose your problems to be able to treat your problems virtually. And also with the electronic health records, you know, that goes without saying, because our goal in the United States is to have a longitudinal health record from birth to death. And that would typically help every single, my opinion, every single American that has that longitudinal record. So if you go, you know, to Utah versus going to Alabama, your information could be seen. And that's our ultimate goal in the United States, is to be able to have that record from birth to death. You can start with trends, you can look at different data patterns, you can see where things may be going awry. You know, so as we look ahead in healthcare, I'll turn it over to Ms. Covington for her thoughts on the trends that are going on in healthcare today before we wrap up.
Yeah, absolutely. Technology is a huge component within healthcare. So making sure as a candidate that you're very comfortable in an area of technology, because it will likely be leveraged in your role. In terms of an aging population of boomers, right? Boomers have had cell phones now for years. And so even the care continuum is starting to look different. In addition to telehealth and telemedicine, we can have apps on our phones. We have ways that we're connecting with our providers, sharing that data real time, especially for patients that are chronic care or high risk. Diabetes is a great example, right? Being able to see those blood sugar readouts at a constant interval is so important for that patient care, especially when it comes to your juvenile patients, right? The ones that have a little bit harder time communicating. So we're seeing technology introduced in beautiful ways, helping to connect patients with providers on a real-time basis. Moreover, 100 years ago, healthcare wasn't global, right? Healthcare was a community-based provider doing their very best, but not a lot of consistent sharing of updates in medical advances and practices. And now that's at a provider's fingertips. Like, they can look and see, hey, what is the best protocol right now for this? And quite frankly, that just wasn't available 100 years ago. So we're also seeing that as a contributor towards having the population continue to age in a quality manner. And then within technology, you know, the company I work for, one of the projects I've got is we have a startup company housed underneath us, and we are working on an artificial intelligence solution really aimed at cost cutting for healthcare. We see AI on the horizon everywhere in healthcare delivery right now. You sort of can't scroll through your LinkedIn newsfeed without seeing an AI article of some sort. And there are so many great programs that are focused around clinical care. Our company is looking at the administrative side and saying, hey, how can we apply this cool technology to help some cost savings here? Because we know that the margins are going to continue to decrease. We've already seen that, right? Payers are becoming smarter in what they want to pay health systems for, and people are becoming smarter consumers of healthcare, right? So there's not as much need for the fee-for-service model. And so it's about making sure that we're ready for tomorrow, the future of healthcare.
The future of healthcare. I mean, even having access to my own medical records wasn't, you know, thought about 20, 30 years ago, as we're like, now you can just go into a portal, pull up your information, share with other providers as we're getting to that longitudinal. So I am with you. Well, I just want to say thank you all so very much, because guess what? Once you enter that field, how do you get promoted? The promotability, or what we call upward mobility, a degree is essential. Consider enhancing an education to acquire leadership, medical, and IT knowledge, as Ms. Covington so firmly pointed out, because you will have that information, you will have that area to be leveraged up under you as a healthcare manager. Diploma or AS degree in allied health, a BS in healthcare management right here at National American University, even an MBA or a master's management in healthcare administration, and additional certifications. Other items that will help you to really move up the chain and move up that ladder of success is, number one, have a strong work ethic. Have you ever worked in a place, or think about the place where you've last worked, and you say, you know what, this individual at my company has a very strong work ethic. What does that look like to you? Do they come early? Do they stay late? Do they give 110%? Do they check their work for accuracy? Do they exceed productivity? Were they honest? So those are some of the key elements and aspects of having a strong work ethic. Also, seeking feedback for improvement. It's good because it gives you a perception about you that comes from another person's perspective. Make sure you take the information when you're getting feedback for improvement and use it to make a positive change. I know I have to do it on a daily basis. Any feedback that I'm given, I look for, what could that be? What change could I make to be able to improve on what I'm doing in my expertise area? Also, don't overlook the small things. Being detail oriented a lot of times helps you to understand more about what's going on in your organization. When leaders think of their job, they typically think about strategic management and big decisions, merging with another hospital, expanding a different wing, but it's the small things that we can do to really, really make an impact on people's lives. Focus to start to impact internally with small gestures, note cards to your employees, and different acknowledgments. It's about going out and getting to know what makes people feel valued. That really, really does help. And last but not least, remember, you're in the relationship business, the business of people. You're really wanting to understand and have, that networking capability, those good communication skills, because you're in the relationship business of people. So in healthcare, you really, really have to understand that's your number one business. Ms. Covington?
And I would echo that wholeheartedly. The relationship business aspect of this. Healthcare communities are small, right? When you look at the number of jobs available within the healthcare sector in your region, it is likely that whomever you work with now, 15 years from now, you're going to cross paths again, because we work in an ecosystem. And with that, making sure that the impressions that you're making from day one are impressions that you would enjoy someone remembering about you in the next role and the next time that you cross paths. In addition to making sure that you're not overlooking the small things, I think really being focused on driving process improvement helps with that promotability, making sure that you have those lenses on, those glasses to see, hey, how could we do this in a better light, rather than just precipitating and continuing to do what's always been done, making sure that you're doing it with the intention of improving upon previous structures.
Absolutely, and that will enhance your promotability. Good deal, good deal. Well, we wanted to ask if you all had any questions, comments, or concerns about any of the information we presented here today. Healthcare management is thriving. It's not going anywhere. It's a very stable work environment. And I just really, really hope that you learned some information today. And if you have any questions, we'll see let's see if Nancy's going to help us with that. There we go.
Yeah. Well, thank you both so much. This was fantastic. And we do have some questions. And for those of you on the line, if you have something that occurs to you, go ahead and send the question now. Let me start with the ones we've received. And these are for either or both of you. How long does it take to get into the healthcare management field?
Well, that kind of depends on you. It depends on the path that you want to take in order to obtain the degrees necessary, such as the healthcare management degree at National American University. We have a 2+2 program where if you've already had a diploma or a certification or an associate's degree, we take a certain amount of credits from that particular diploma, certification, or associate's degree, and you finish out the core courses in the healthcare management program. So that's about 2 years. If you wanted to get a bachelor's degree in the healthcare management program, that takes anywhere from 3 to 4 years, depending on, how fast you're moving and how many classes you're taking. And then from there, as you're going through that experience, the things that we've talked about here today to get your foot in the door and to become the best candidate possible, adding those items that you may not feel are contributory to your resume for this particular position, but if you didn't have any specific healthcare work or related experience for working, you would put that on there as well, but also volunteering. So as soon as you're done with school, typically for me with healthcare management, it was literally as soon as I graduated with my bachelor's degree.
And I would echo very similar sentiments. I think that the trajectory that you have for entry into healthcare is going to be widely dependent on how you're preparing yourself for that career. You can be very aggressive in your approach, or you can have a more laid back approach. Also, there's a lot of PRN kinds of jobs available through the facilities. Remember, hospitals are 24/7. So even if you have a main job and you're looking at a career change, one thing that you can do outside of volunteering to help start building that network and that understanding of how healthcare is functioning on a day-to-day basis is by picking up a PRN job. Usually those jobs are about 2 shifts a month. It can be something as simple as sitting one-on-one with a high-risk patient, and you'll get to go through the care training. You'll get to be on the floor with nurses. You get to understand how healthcare is delivered. You are exposed to the health system as a whole. And that's one of the ways that you can simultaneously help prepare yourself while you're still in the pursuit of your education. Just one example.
Wow, fantastic. So I do have one additional question that came in. What does consulting in healthcare management look like?
I feel like I can totally take
Want to start?
What I do. I could probably talk about consulting in healthcare all day long. I'm going to just narrow my focus a little bit for the sake of time. One of my present engagements is I have a contracted agreement where I'm providing executive consultative services for a self-pay team. So they are going through a shortage with their leadership staffing. They have a key role that isn't present right now. And so I've stepped in and I'm helping provide that interim support. It's been very evident that there's some opportunities for improvement, particularly in the compliance area, which when it comes to a self-pay team is crucial because those individuals are routinely talking with the patient. So when you look at the care continuum, that's the last point of interaction, the bill that a patient has with their healthcare provider. So we want to make sure it's a really awesome experience so that we get them back in for the next set of care that they need and don't off-put them based upon the interaction that they're having with the team. So that's an area where I wasn't expecting it, but they reached out to our company because we have a great reputation in what we do. And we were able to adjust things within our company that I'm also providing support to that team right now.
Excellent. I did consulting for about 5 years before I started my little family. I'm sure I'll do it again. But in consulting, you really have to understand your craft because people look up to you to be the expert in that particular area. So as you're getting those certifications, as you're learning more about it, put it to the test. Make sure that you know what you know to be able to help others. And that's a lot of what consulting is all about. You're being sought out to help others because you have knowledge, expertise, skills, and abilities that are needed for that particular organization.
And, another project that I'm working on for consulting that I could speak to with a little bit more specificity, it's a startup that has created a test that will allow for predictive modeling for future diagnosis for behavioral health concerns, right? And behavioral health is a huge current focus in the industry. And I think it's amazing that they've been able to create a test that helps with this predictive modeling. So with any amazing program in healthcare, though, if it's not a financially viable solution, it's not going to succeed, right? It has to be able to at least break even or have a slight profit margin in order to be successful in the industry. And so one of the areas that I've been engaged with them, like you said, you have to be an expert in what you do, is helping to craft the modeling such that it is going to be a financially viable product and solution to offer in the market.
Wow, that's amazing.
Yeah. Like I said, no 2 days are ever the same in my job.
Not at all.
Oh, great answers. That's so much information. Thank you so much for sharing that. And I want to thank everyone for being on the call. I think our time is coming to an end here. Dr. Smith and Ms. Covington, is there anything else you want to add before we close the webinar?
If you think of any other questions, comments, or concerns, be sure to reach out. Our email is healthinformation@national.edu, and we do prompt responses for you.
Fantastic. Well, thanks for joining us, and look for an email with the slides and presentation. Have a wonderful rest of the week. Thank you.
Thanks.